Okay, so yes, Terry would normally have come along, but unfortunately there's a regional event on. So I cover the West Midlands as a whole. So Worcestershire is part of my patch. So I've agreed to cover. Um, Everybody will be very aware that dental services have been pretty well challenged during the pandemic. I had a look recently at the update that was sent through from Margaret about the queries into Health Watch. And it's clear that people are having trouble accessing services at the moment, more so than previously. Um, I've wanted to start with a couple of myth busting things though. A lot of the queries are around registering with a dental practice. And I just wanted to be really clear, you cannot register with a dental practice in the same way as you can with a GP. Dental services are commissioned in a different way. I buy activity from practices and people are free to attend any practice. Who will accept them. I appreciate that that can be a challenge. And you're only really linked to that practice technically whilst you're in a course of treatment with them. However, we know that practices confuse the issue because they quite often tell you that they've got a waiting list or that you are on their list or you're not on their list. And actually, it's not a bad thing in normal times to have people on a recall, so that you can do the preventative work, have regular checkups. That has been a bit challenged during the pandemic because capacity has been severely restricted. The other myth busting that I wanted to do right at the start is everybody has this thing in their head that you need a 6-monthly checkup, which isn't the case actually. Checkups should be tailored to the individual, and most adults who haven't got problems would only normally need a checkup every couple of years. It should be a tailored recall schedule. For children, it would be more frequent, and for people who've got particular oral health problems, yes, you would be seen more frequently, and sometimes more frequently even than 6 months in a normal situation. So just wanted to start up front with that, because I think that kind of frames the conversation a little bit, because we do get an awful lot of queries in about registering with a practice. And I think that's with services under pressure at the moment, that's causing some of the problems, because practices, whereas they might be happy to see patients, the idea of having them registered and having the ongoing care is more of a challenge at the moment with the activity. Could you move on the slide, please? I thought I'd start off with a little map of the number of practices and where we've got them around Worcestershire. Each one of those, where it says DSE, that's a dental service, but where you've got the little bubbles with numbers in, that's the number of practices in a particular area. So it just gives you an idea of the spread of high street dental practices that we commission NHS care from. It might be slightly not up to date because we've got one contract handback, I think, in Eveshum at the moment that may not be reflected in this at the moment, because I'm not sure if it's quite gone through yet, if you see what I mean. So there are some big challenges around NHS dentistry at the moment. It was very impacted by the pandemic. I'm going to show you how much access has been affected and how services have or haven't recovered, because they're still not back to normal. I think everyone else thinks we are back to normal, but dental practices are still only working at 95% of capacity. And that's because of the infection prevention measures that are in place. I'm not sure that people are aware that a lot of dental things, even simple things like a scale and polish, or if you have any drilling done, are what's classed as an aerosol generating procedure. And that means that spray goes up and the dentist then has to close the door, let the air in the room settle, and then clean everything before they see the next patient. And you can imagine the effect that has on the number of patients that can be seen. So that's just to explain to you why dental services have been so restricted, and probably more so than GP or other services. So it's just a little bit of background. Could you move on to the next slide, please? Just to give you an idea here. This shows you going through from when we started to recover from the pandemic in September 2020 right the way through to March 22. I haven't given you April's figures because they are a little bit abnormal. April is always a funny year. We have to sort of estimate it. You'll see the April slide there has kind of 2 bits to it because of the way the scheduling works. So I thought it'd be a bit misleading. But you can see that we've seen a recovery of services, and that green dotted line has been the sort of capacity that dentists have been working to. So they're receiving payment protection for delivering a restricted service because of these capacity issues. And you'll see we're not back to normal yet. For this year, for 2022, they're now working to 95% at the moment. So we're still not back to normal levels of capacity. Hence my comments about the expecting routine checkups every 6 months, because obviously there's a big backlog of people who haven't been seen. People may have more problems than they would have had because they haven't been seen. And we want to make sure that we prioritise the people who need services the most while things are restricted. This picture that I'm showing you is the Midlands wide picture. If you want to click onto the next slide, you'll see that the we monitor it by the integrated care system areas, so that brings Herefordshire and Worcestershire together. So you can see that very much locally it's mirroring the regional picture in terms of we do have some areas that are slightly better and some that are slightly lower, but your system is kind of mirroring. So what I showed you before is probably quite a good reflection of what's going on as an aggregate across practices. Obviously individual practices will be different. We've got some practices who are very challenged.
Simon,
there are particular
I'm
issues
just in a
around
Zoom
recruitment
conference meeting. I'll phone you back later.
And retention of dentists. We've always had some problems, and I don't know if you know, but before, people who've attended dentists may have been aware that there may have been quite a few foreign dentists working locally who've come over from elsewhere in European Union or what have you. And obviously, 2 factors, Brexit and the pandemic, have really hit that hard. So it's getting more and more difficult to recruit dentists, particularly to rural areas. And that's something we're looking at the moment. We did try and run a scheme last year to try and offer out, to try and attract dentists locally, salaried dentists to help. We got lots of practices who wanted to sign up, but we couldn't find a single dentist who was qualifying who wanted to come and work locally to take us up on the offer. So we've had to go back to the drawing board. So this year we're coming up with a new scheme. It's not finalised yet, but we are looking, and I'm not sure, I'm hoping it might cover the rural areas of Worcestershire. The particular challenged areas we've got at the moment are Hereford and Lincolnshire and some parts of Shropshire, but I would count Worcestershire as part of the areas, some of the rural parts. We're looking at maybe whether we can do a golden hello scheme to try and entice some more dentists in to see if we can get more capacity, because that's another, apart from the restricted capacity due to the infection prevention measures, there's still issues with getting dentists working locally. And obviously if they haven't got the dentists, then they can't see the patients. Could you move on to the next slide, please? Obviously all of this has had a dreadful impact on access. This is what has happened to adult access. It gets measured through the GP surveys, and we measure adults on a 24-month attendance and children on a 12-month attendance. I haven't bothered showing you the children. Children's access was really badly affected early on in the pandemic for a number of reasons, perhaps because parents were quite nervous about bringing children even when services were available, and because dentists thought, oh well, the children, they're just routine checkups, they don't matter. We did have a push through the Chief Dental Officer, and children's access rebounded much quicker than adult access did. But you can see here that we've been going down and down and down, and it's been very depressing. And it's just quite good that you can see right at the end of that graph that we've started to turn the corner. It couldn't really have got much worse, because if you look at it, 2 years ago, all services were shut for a poor period right at the start of the pandemic. So you can see that there's slight light at the end of the tunnel. Things are improving, but we've still got a shortfall of all of these missed appointments, although I would caution that probably not all of those appointments were necessary appointments, because they may have been some of the 6 monthly checkups that didn't necessarily need to happen. So hopefully the picture is a little bit more encouraging than that. Do you want to go on to the next slide, please? That the position I've just shown you before is about in primary care, you know, going to your high street dentist. We know we've also got big backlogs for people who are waiting to be seen in the hospital to have teeth extracted. And this is a rather sobering and depressing picture. So you can see from the graph with the green bars that pre-pandemic, a 52-week wait, that's somebody waiting a year, was an unknown thing. You know, if I had one of those, that was a serious incident, big investigation. And you can see that through the pandemic, it shot up. This is for the region as a whole. We had over 7,000 patients waiting over a year at the worst point. It then started to recover, but I have to say that was probably because primary care services were closed, so there were fewer referrals, so the services had a chance to catch up. And then as services have reopened again, we've seen a bit of a bounce back, but it's sort of got stuck really. So we've still got a lot of people waiting a long time in secondary care. The trusts, the reason it's not improving at the moment is because we do have 104-week waiters, people who've been waiting 2 years, and the trusts have been doing a huge bit of work to get rid of those waits as a priority. Obviously, anyone urgent gets seen anyway. This is about more routine care. So we're working at the moment on any 2-year waits, and then there's a target that nobody will have been waiting except by choice beyond the end of this month. Oh, sorry, beyond the end of June, and then they'll start to look at people who've been waiting 78 weeks, and hopefully they will all be gone by the end of next year. So we're kind of working our way through big backlogs in hospitals, because you'll appreciate hospitals were having to focus on COVID care at one stage, so a lot of services were shut. So that's sort of a little bit of the background around services. I wanted to say urgent care, we know that there are issues around access for routine care. Urgent care, we do have the dental access centres locally, through the community dental service, which is through Herefordshire and Worcestershire Health and Care Trust. We have retained dental access centres, so you should be able to get urgent care through 111 if you've got a problem that's triaged and deemed to need to be seen within 24 hours. And we know that there are pressure on the community dental services at the moment. So we've gone out and we're just about to put some extra capacity in. We had it in last year. There was a bit of a gap, and then because we had to sort out what money we had, and then we've set up another load of investment schemes this year. So we've just approved, and I think we'll be setting up to go live on the 6th of June, three practices that will be providing dedicated urgent care slots. I believe one's in Kidderminster, one's in Redditch, and one's in Malvern. These are for patients who need to be seen urgently, because we know that a lot of patients are having problems because they ring 111 and they're told, ring these practices, and the practices say, I'm not taking anyone, I haven't got capacity, particularly if they're not a regular attender. So what we've done is secured some dedicated slots, which are for the NHS 111 nurses to be able to refer into for people who've got stuck. So we're trying to do what we can to help. We are doing a number of other initiatives to improve things as well. So we did a big scheme last year for weekend access, to pay dentists to be able to come in and do extra sessions at the weekend. And that was very popular with families actually on Saturday mornings. And that was very successful. Then we got some money nationally because there was a big national push. So we ran more sessions at the end of the year, but that all lapsed at the end of March. But we're going to go out again shortly to try and get more weekend access sessions in again. So again, that will help to cover some of the shortfall in services, but it does depend on dentists coming forward. We are paying sort of enhanced rates so that they can get staff in on overtime to see more patients. So that's sort of a bit of a background there. Did you want to go on to the next slide, please? I was asked to do some comparisons. So this was the picture, local access figures as at June. I can send over the link for because of the problems I was having getting the slides done in a hurry. I think there is a more up-to-date picture for December 21 available now. I pulled these graphs out. There's a dashboard which is open to everybody to look at, which you can zoom in and look at your local area, and it gives you benchmarked against national picture. So this was the picture as of the 30th of June. It's always a little bit behind because all the data is validated, but it gives you a picture of what's happening with access. And I've done you one for adults and then one for children. So it shows you the England. So you'll see access is slightly worse in Worcestershire than it is in England generally. It gives you the breakdown in terms of ages as well. And if you want to go on to the next slide, you can see that there's a similar dashboard for the children's. So you'll see it's not dissimilar to the national picture. I can try and send through the updated December slides. I was having problems on the system accessing this morning. So but those are they're a dashboard that can be seen publicly and you can look at, and it gets refreshed, I think twice a year, June and December, if people are interested in seeing how things go. Look at. I've mentioned about the urgent. Oh, the other thing, yeah, if you go on to the next slide, please. Yeah, so I sort of rounded up some key points. So the dental registration is quite a big one, really, because I think there's a lot of misunderstanding about that. People think that they're registered in the same way as GP, that their notes follow them around. That isn't the case. I've mentioned about the severe impacts and that it is recovering, but still big backlogs. We did lots of recovery initiatives last year. We put in a lot of money locally. There was some national money. We've had to sort of regroup for this year, but we've now got approval. So we're doing waiting list initiatives in secondary care, helping to pay for extra sessions at weekends. We're doing support to the community dental service. They manage the special care patients and the children who can't be managed in practice. I'm recruiting some practices. I got it started just before the end of the year. We've trained practices to work with children, to maybe act as a support to the CDS, so that children who are perhaps being referred into CDS, who could be better managed in primary care by people who've got the training, can go and be seen more locally to avoid having to wait a long time, so that the CDS services, the community dental services, can focus, because they've got the very specially trained staff who have to do, you know, when you've got children who need multiple extractions under general anaesthetic, so that they can focus on the children who need it most, or on the special care patients, so that we can try and sort of give them a bit of support because their capacity is restricted. I've mentioned about weekend access and the extra urgent slots that we're putting in locally. And the other thing I just quickly wanted to mention was the fact that we're working collaboratively with the local authority to strengthen oral health promotion lately, the prevention side of things. We've put significant funding in, and that's recurrent funding. I mean, put some money in last year to try and do, you know, toothbrushing schemes, things like that. We've put a lot of money in to try and get toothbrushing packs into food banks across the West Midlands, because I know that's quite topical at the moment with the cost of living pressures and things. So we thought that would be a good way of getting messages into particular vulnerable groups. But the thing I'm most pleased about, and we're working on the detail at the moment, is we wanted to have a dedicated health promotion team across the ICS, across the Herefordshire and Worcestershire system. There's lots of bits going on. There's bits going on in the local authority in Worcestershire. There's bits going on in the local authority in Herefordshire. But we have the community dental service who did have a post previously, but we thought it would be more robust if we could have a team, because then that helps us to get a career pathway to attract more people who are expert in health promotion. And this is to do the work with like care homes, nursery settings. It's about prevention, because I think that's the best way out of the situation we're in at the moment, is to try and prevent people having problems with their teeth in the first place, starting young and what have you. So we're doing that work at the moment, and it will be collaborative working, which I think will be very good for the systems going forward, because our services are being delegated out to the systems to go back in with GP services and everything else. So it will encourage joint working, more joined up holistic approach, and we're hoping that we can develop those teams, and that the local authorities can set the priorities each year of what the work plan will be, but that we will monitor it and provide the framework for it. And just the last thing I wanted to mention is we were very worried about whether patients at risk for cancer were being missed during the pandemic, because a lot of that gets picked up opportunistically when people go for checkups. So we've done quite a lot of work with campaign locally to ensure that patients are picked up and referred. And we've also got that pathway onto our referral management system, so that dentists can send photographs in, so they can get a quick return to check that people are being picked up if they're at risk of oral cancer. So that's a whistle-stop tour. I hope that covers some of the things. We did do a report for the Health and Wellbeing Board recently, which has got an awful lot more detail in it, but I don't know if people have got any questions. Is that okay?
Yeah, thanks very much, Nuala. That was really interesting. I think, Simon, you did have a question, didn't you? And then
I've got some questions. I've got more than one, in fact, if that's all right, Chair. The first one, you just picked up on cancers, Nuala.
Sorry?
Nuala, you just my first question was going to be about cancers.
Yes.
And I mean, I've been the cancer lead for Health Watch for long time now. And I certainly remember a time when oral health was making a big play about the role that dentists played in identifying oral cancers and the importance of having regular reviews. And I was just trying to square that with, okay, people might not need a dental checkup from the point of their teeth every few years, but how about the check on oral cancers? Because that used to be the mantra about one of the reasons why you need to go to the dentist regularly for a checkup.
But I think that would be covered by the tailored recall thing, because if you've got somebody who's smoking, or if you've got somebody who's using, chewing tobacco or something, or is at higher risk, then you'd set a recall schedule that was more frequent.
Okay.
Yeah.
Okay, so that was my first sort of detailed question. The second one was, through the course of your sort of presentation, you've sort of put a lot of the problems that people have accessing on the backlog that's built up with COVID and the obvious restrictions that COVID introduced. But you also mentioned workforce. You touched on workforce.
Yes, it's a huge problem.
And I've got to say, when we talk to dental practices, there doesn't seem to be a huge appetite from them to actually engage in NHS dentistry.
I would. That is probably a big issue, and it's not just locally; it's nationally.
Yeah,
the teams are quite demoralised at the moment. There, I will be honest. A lot of dentistry is very regulated. We are constrained with what we can do. I know people get very exercised about dental charges, but it's in law. It's in the regulations, and the dental contract is set up in a particular way, and it doesn't work brilliantly. There were problems before. You will see that people say, oh, I can't get an appointment. I have spare capacity. I am clawing back money at the end of the year because they're not using, even before the pandemic, because they're not using the activity I'm giving them. The contract doesn't work well to encourage what we want to happen. They did do some contract reform work. We didn't have any pilot practices in your area. We did in Herefordshire. They've withdrawn that because it made access worse. They tried a registration model, like through GP. There was some very good learning from it. So they widened the scope of practice for the dental team. Because again, there's only certain people can do certain things by law for dentistry, and they did change it, and that was beneficial. But actually, quite a few dentists took the money and didn't see the patients.
Right. So my question was going to be about a lot of the things that you've told us about you're doing in terms of recovery.
Yeah.
Right. Are linked to the the current model of provision.
Yes.
But it does seem that if you look towards the future,
Yeah.
the current model of provision is frankly broken.
Yes.
And what is being done to address that model of provision?
So that's the dental contract reform work, and that's being managed nationally, and we're doing what we can to lobby. I'm involved personally on a dental contract reform working group around the community dental services. So I know we've been trying to get a voice in nationally. It's quite political though, and it is quite difficult. I mean, part of the problem we've got with recruitment is a lot of the dentists coming through now, they want to do the cosmetic dentistry. They don't want to work in the NHS. And it's, you know, I have sympathy with some of my contractors because they're trying to find dentists and the dentists would rather do.
Well, that's the bit that needs workforce. If you go back to, we need a workforce plan. You know, that's
Yes,
me.
yeah.
That's not you saying that. That's me saying,
No,
from a Health Watch
absolutely.
perspective, I think
We work
we
with
need a
Health
national
Education
workforce plan.
England. Yeah, we work with Health Education England, and we do try and lobby, and we have done. That's why we did that initiative locally. So we try and do what we can locally, but I agree with you. We need more oomph nationally.
We
Yeah.
don't need to keep pointing out the current problems. It just occurs to me that Health Watch England are doing a lot around, you know, trying to identify what the problems are. Well, I think we all know what the problems are.
I think we do, and I think
we've
some of
been
them were
reporting those back to you now
pre-pandemic.
for a long time.
Yeah.
Actually, Health Watch would be better geared towards trying to propose some solutions at national
Yes.
level to this, such as, you know, there needs to be something to tempt dentists in, newly qualified dentists into the NHS and retain them in the doing NHS work for a number of years, until they then get cut free to go and do whatever else they want to do.
Well, hence our Golden Hello scheme. We got fed up of waiting for something national, so we're trying to do what we can locally.
All right, that'll. I don't want to take all the time, so that'll do for me. Oh, one last thing.
Yeah.
And it's just on NHS 111. I bumped into a patient on Monday who told me that they'd called NHS 111 with toothache. They'd been told to go to see their GP for antibiotics.
What?
And the GP had refused to prescribe them.
Well, quite rightly so. So actually, if you hear of anecdotes like that,
you want those ones back.
Please do tell us, because we will pick it up and we can get 111 to listen to the transcripts of the calls. I would caution though that sometimes what patients say and what actually comes out on the call isn't exactly. People sometimes misunderstand things.
Yeah, and one of the problems is, it could have been, if you needed antibiotics, this is where you might have been able to, be able to get them eventually.
But I do agree, we do investigate where we get made aware, and if there are issues, we try and get training in at the 111 end.
But I can definitely feedback that wouldn't have happened.
It should not have happened.
Okay, thank you.
Thanks. Jonathan.
Lula, can you hear me okay?
I can, yeah.
Slightly crazy looking headphones. It's just like John Watson. Thank you for your presentation. I thought you provided a very honest, clear-cutting insight into the realities of services. I've just got two questions really. One is just to go back over the registration and emergency access area. And I come at this from a person who works with people who are experiencing homelessness. Their dental hygiene and their dental is particularly bad. Prevention is often a waste of space. Have got many teeth left. So that's the first question, if I may. And then I've got a second question, which is more broadly to understand whether dentists are NHS employees or whether they're private businesses. Let's do the first one first, the registration emergency access. Just can you go through that again? You said it right at the start.
Well, you talked about homeless people particularly. I just wanted to reassure you that one of the other schemes I didn't mention that we are working on, but we're still at an early stage, and we had a meeting recently, I think, Margaret, you were on it, where we were discussing about local initiatives. We are proposing to do some specific work to improve access for vulnerable groups, because one of our statutory duties is to look at health inequality And there are some services locally. We know that one of our community dentists actually volunteers at a local centre to provide dental services. But what we want to do is see if we can commission something specific and tailored for where we're aware of groups. But this is the point about there's nothing to stop anybody trying to get into any dentist. There's no geographical restrictions. The problem is finding a dentist who will accept you. And I will be blunt that the way the contract is set up, people who've got particular needs or who might be more challenging to deal with because they don't turn up to appointments, do you know what I mean, because of a chaotic lifestyle or whatever, are not an attractive proposition for a dentist because of the way that they're remunerated. So that is a problem, which is why we're looking at whether there are alternative models, because sometimes for a certain group need to go to them rather than trying to get them to go to the service. So they need a slightly more tailored approach. So we have got some work. I've got one of my senior commissioning managers, Tracy Harvey. She actually covers Birmingham and Black Country. She's got a particular interest in this. She's leading a group at the moment to look at how we can tackle specifically two things to look at inequalities. One is particular groups, vulnerable groups, but the other is looking at areas of deprivation, whether we can get some targeted services into areas where we know there's really bad oral health. Do you know what I mean? So that we've got specific. Some of the problem that we've got is the NHS 111, because those sorts of patients are invisible in the sense of, even if they get through, there's nothing that flags them to be able to route them into services, because the triage that is done is blind to any of those issues. So it's very difficult for us to identify them and route them to the right services at the moment. We're working with 111 at the moment about whether we can set up something, expand the existing CAS clinical assessment service. We've got nurses to see if there's anything we can do around that. So that was your first question. What was the second one?
That's it. I just asking about the status of dentists. I thought that dentists were NHS employees.
Oh no, sorry, no, they're not. No,
they're private businesses, are they?
Yeah, they are. They're just like GPs. They're private businesses. We commission them. They are usually there are very few exclusively NHS practices. There are a few, but not very many. Most of them are private dentists who have a contract to do NHS dental work. They should not be funneling you into private care. They have a contract for NHS work. You should not be told, I can see you privately, but I can't. They are allowed to make you aware of an informed choice, but they should not be funneling patients into private care. The model is quite odd because a lot of them have what are called associate dentists. So they're almost like subcontracted, self-employed dentists who work for the dental practices. There are a few employed dentists. My community dental service and my hospital dental services, obviously the staff who work there are employed, they're NHS employees through the trusts.
Yeah, and simply put, they have a contractual obligation to the menu of a molar extraction is £3.50.
Well, there's a national pricing structure which is under review at the moment, but and that's part of the problem, and we're hopeful that that might change, but it will take time because it has to go through Parliament. We don't know what's happening. We're waiting to see what will replace contract reform, but we've been making noises about the fact that it doesn't always work. We have got some flexibility locally. We can do what's called flexible commissioning, which is we can move away from the national model and do something locally. If we wanted to do a targeted service for homeless people or something and commission. The only problem is that flexible commissioning isn't very flexible because we can only do 10% of the contract. And if we've got dentists who've got small contracts, that's not a lot. So it's quite difficult to use. But we do try and use it if we can.
Thank you. Just one offer and one final observation, if I can. Please use my contact details if you or your colleagues wish to talk to groups that want to look after both experiencing homelessness. Worcester has a good network, it's very tightly knit with organisations involved in that. And that's a good way of getting us all together to understand. And perhaps just an observation, we've had a number of people who stay in our hospital service who have had kind of whole teeth replacement, really, the sort of stuff that film stars have. And I am impressed by it, and also we shouldn't underestimate the impact that that has on their self-esteem. That they can smile and have a set of teeth too, and that seems to be something that more and more people are asking me or my colleagues about how they do that. It's just worth knowing that that's something that's
it's worth mentioning that there is an initiative nationally. Again, I've been on a working group, because when people lose their dentures, often elderly people, when they go into hospital, they seem to make more fuss if they lose sort of personal property, but they're not bothered about losing people's dentures and the impact on somebody's life if they lose their dentures. You know, eating, speaking, confidence, everything is huge, and yet it's almost blasé and expected. But the hospital should replace they should go to a private dentist and get them replaced. We're doing a lot of work, but we're trying to do a lot of work around prevention, labelling of dentures, practices in hospitals, because you're absolutely right. I mean, that's for dentures. I mean, you're mentioning about actually having it is quite restricted what will be done. The NHS does not do, I mean, you're not talking about cosmetic dentistry, but
no.
But it's, do you know what I mean? So it's like, I know I do have people who regularly come saying, I would like a full set of implants, please, on the NHS. It's not going to happen. You will get implants, but they will be for particular, there's criteria that the consultants work to.
Thank you, Lou. That's
okay.
Thank you.
Thanks, Jonathan. Do we have any other questions at all? David.
I've been carrying out a review of the dentists in my area, Eveshum area, and every single one of them will not accept NHS patients without referral. And the nearest dental surgery that we have available to us is in Tewkesbury, and they are actually advertising for people to come to them to get treatments under NHS rules. So the other problem I have is, you mentioned earlier on about the centres you're setting up. You mentioned Redditch and Kidderminster and Malvern, but that means all of the southeast corner of Worcestershire is not covered again. And we see this time and time again, where we've got a massive increase in population in this area, but we're not getting any services to cope with it.
Yeah, I know that there's a problem in Evesham. We're looking at Evesham at the moment. Where we get handbats, we will be looking to put the activity back out again. The only reason we haven't got Evesham covered is it's chicken and egg. If we don't have the dentist, then they don't come forward to do the services. I've got a huge problem in Herefordshire where I can't get any centres because none of the dentists will come forward to do, I have all these initiatives and nobody will volunteer to do it. Because if you've got a problem in the first place, then you've got nobody to do the extra schemes. So we're aware of Evesham and we are looking at Evesham at the moment. It's on our radar. If for the three centres that I've talked about are for emergency, I think it is reasonable to travel for emergency. So actually, we're quite pleased that we've got a kind of network of coverage across. There are still the DACs. There is still the local dental access centre in that area. So
that's not working either.
No, well, that's why we put the extra capacity in to help. But yeah, no, it's a valid point about Evesham. I was interested actually though, because I looked specifically when you shared the information about the inquiries and complaints that you'd had through, and I was looking to see whether Evesham would be sticking out, and it didn't, because I was aware of Evesham, so we did look quite specifically to see. But we are aware of Evesham. We are looking at Evesham. If necessary, we will run a procurement in Evesham.
Yes, please.
Yeah. But I've got to round up. It's if I need to replace services, it's how I do it. And sometimes we try and it's quicker and easier to disperse the activity The problem is you have to have some services there in the first place to disperse it to, and then you look to fill a gap by going out to get a new practice. Getting a new practice can be quite tricky sometimes.
Yeah. Okay.
But I acknowledge there is a problem in Evesham. We are looking at it.
Thank you.
John, you had a question.
Thank you. Hi, Nuala. I just wonder whose responsibility it is to publicise information and raise awareness with the public about how you access dental practices and what your expectations should be.
We've done, so this is a problem. We've done quite a bit of work. So we have done stakeholder briefings throughout the pandemic to update. And obviously coming to meetings like this, we've been trying to get out and go to the various things, because I cover a huge area. I cover the West Midlands, so a lot of local authorities. So we've been doing quite a lot of these, but we realised that they're not hitting the spot. So we actually had a meeting last week with our comms team to look at a dental access campaign to see how we can get messaging out. So they're looking at what they can do at the moment to see if we can get some, it's finding the routes. I know sometimes comms teams are very keen on like social media and everything, and that has its place, but it doesn't hit everybody. Do you know what I mean? So I think they're going away to look at a strategy to see if we can get, we have been agitating for quite a long time for a national campaign, but we're not getting any traction to get it, because I think some of the messaging needs to come out nationally, would be my personal view. So if Healthwatch can do anything to lobby in that direction, please do, because we'd be very, very grateful. But we will try and do what we can do locally. And if you've got any suggestions, because obviously you're very plugged in, as your colleague said, in terms of networks and what have you, if you've got any feedback on what you think would work about the route to get information out to people, please do share with us, because I can feed that back to our comms team.
Thank you.
Thanks, Nuala. Yeah, I suppose one of the things is that patients don't understand about whether you register or don't register, but it's also being perpetrated by the practices themselves, isn't it? Because they almost talk about
They make it worse. Yeah, absolutely. I get so cross with them, because it's no wonder people are confused, and because people assume it's like GP. So you can understand why people do, and it doesn't help. And this is the part of the problem. I mean, that's what I was going to say to you. So you put on your report queries about registration. What we tend to try and talk about your usual practice, rather than being your registered practice. Do you see what I mean? But it's going to take quite a long time to change the way hence the talk about how we can get the messaging out to the public. My suggestion to patients is always, don't say I need to register and I need to register my family. Just say I need to be seen. You're more likely to get in than if you're trying to seek an ongoing commitment. Yeah,
we have had people who've been turned away because they haven't used that particular dentist, and they go, well, sorry, you can't now because you haven't used this for 2 years.
and can I say, I personally have experienced that myself. I don't live in this area, I live in Gloucestershire, but my dentist did that to me. So I entirely recognise what you're saying, and when we hear about it, we do have words with dentists about it.
Thanks. Simon, you had another question.
Yeah, I think it just demonstrates being able to tell patients how to have an informed discussion with patients, with dentists, and actually challenge them about whether they've used all their dental units, as opposed to I want to register. The question, I just wanted to take you back to Evesham. I just wanted to check out with you, just to be absolutely clear. There is a dental access centre at Evesham Community Hospital. Is that right?
So I was trying to look on the system just before to check the current things. So we used to have a whole network. In the pandemic, some of them were temporarily shut because of the issues, because the services retrenched. What I was trying to check just before the meeting, but because I couldn't get on the system, was which ones were currently operational. The Health and Care Trust recently did quite a big bit of work with their premises to upgrade them, and you'll appreciate that I'm not right at the coalface in terms of
I appreciate that.
So I will check and see where we are,
because if they've closed it without actually talking to patients,
well, that
they've taken an opportunity of a COVID opportunity. Then that's something that we would want to take up with them, obviously.
Well,
Because
can I just
that's
say
a significant change to service provision.
absolutely. So we've been doing this work. So we've re-established our regular contract meetings with our providers at the moment. And one of our questions is challenging on, okay, you are now getting back to normal. What are your plans? Do you know what I mean? Because some of what they've done was perfectly legitimate in the throes of the pandemic. But now we're asking those questions about what are your plans to get back to normal.
And I didn't want to confuse it, because if I'm right, there was an emergency dental access centre, wasn't there?
Now so out of hours, the out of hours did change.
Yes,
so
I know, but I don't want
yeah.
them. I know that changed, but I don't want them to
Yes,
confuse
we
that.
consulted on that change.
I don't want. I know,
Yeah.
but I don't want to conflate. You know, there is a difference between the out of hours centres, for which
Yes.
we were involved in that, and we know that
Yeah.
Evesham ceased to be an out of hours centre.
So you've now got Redditch and you've got the Worcester one.
But what I don't want to see
there's
is
a whole network, but those are
I
the
don't
two.
want to see a trust managing to conflate that decision into a decision to change the local access dental
I will
centre
pick it up
provision.
as an action to go and check.
Oh,
Is
that's
that
brilliant
okay?
of you, Nuala.
And
Thank
particularly
you
in
very
light of
much.
the issues at Evesham, we'll make sure.
And just to be clear with David, when you were talking about facilities available in Tewkesbury, was that dentistry advertising for patients, or the local dental access centre at the community hospital?
No. It was a private dentist, if you like, that was advertising to say that they got
NHS available
opportunities for patients to join them as NHS patients.
Yeah.
Going back to Evesham, by the way, the Evesham Hospital is listed on the NHS site as only accepting NHS patients if they're by referral. They don't have walk-ins.
No, so the DACs shouldn't have walk-ins now. We moved the model because for urgent care, it's through 111. So it's because you get properly triaged then, because there's often what people think is urgent and what is urgent is slightly different. And we want to make sure that the people who've got the urgent needs that need to be dealt with, so we have a 24-hour provision. There's like a 5-day, and then there's routine. And sometimes people, it does depend on whether you're in pain, do you know what I mean? And you get advice, and it's just there's a triage done as to how quickly you need to be seen. So that triage is done through the 111 system rather than having
how many people know that? You know, if I fall down and break a tooth, I go to the emergency centre, if you like. Yeah. And then I'm told I can't go there because I haven't gone through 111 to get an appointment to go to see them. There isn't enough publicity, I feel, in the range of services that
what's
are
available, where
and how you access them.
Okay, well, I'll take that up because I think that links back to the previous discussion about comms and being clearer with people. I think there's a lot of confusion about charges, dental charges as well. We find that patients sometimes get confused as to whether they're being treated privately or not privately, because there are dental charges. Obviously, there are sections of the population who are exempt, particularly children, but the dental charges is something we can't get away from. It's required to be levied. Do you know what I mean? Because it's a government thing. And I think there's a lack of understanding about that as well. We often get involved with complaints and we find out that it's actually private dentistry. Do you know what I mean? So sometimes people get quite confused, I think. So I think there's a valid point there. Yeah. Thank you.
Very much. Do we have any other questions? David, did I see your hand up? No. Okay. Actually, I have one very niche question. During the pandemic, sorry, it is very niche. People who were entitled to their 1 year free because they're on maternity, because they were having
the pregnancy. Sorry, you did mention this when your email, didn't you? Yeah.
Were they allowed to extend that year if they couldn't get access during it at all?
There was no provision made. So pregnant women should fall into the vulnerable category. The reason that you get free dental care while you're maternity and the year after is because of the physiological changes that put you more at risk. So that's a pragmatic response to making it easier for people to access that care. And it's really good as well to getting good habits in for children too, what have you. But during the pandemic, the payment protection that was in place last year was linked to a standard operating procedure, and the dentists were required to prioritise urgent and vulnerable patients, and pregnant women should have fallen into that group. The problem we've got now is that that has fallen away as of the 1st of April. So there is no requirement on dentists anymore to prioritise. Best practice would be that they should, but whether they are, or whether they, because they will be getting a lot of pressure from their regular patients who want a routine checkup, and those are easy patients to see. You know, if you want to bang through some activity without having to do, this is where we went back to the discussion about the contract and how it incentivizes or doesn't incentivize the appropriate work that needs doing. And which is why we want to make the public aware. Please don't be insisting on a 6-monthly checkup if you don't need it, because we'd rather that capacity was used, and we would be trying to nudge our dentists to be seeing the people who really need to be seen. Yeah.
Brilliant. Thanks very much, Neela. Any further questions? Brilliant. I just thank you very much for joining us, Neela. It was really interesting and very informative. And we'll just have to...
I acknowledge things are not great. They're not as good as they should be. You know, we see the MP complaints, we see the complaints, and we do look at all of them. So we are, it was just to reassure you, to try and explain to you some of why we're in the situation we are and some of what we're doing to try and make it better. But there are no quick fixes. If there were quick fixes, I'd have done them already.
Brilliant. Thank you very much. Thank you.
Thank you. Thank you very much indeed.